CHUN by Absolute Medical Coding Solutions. What is CHUN? CHUN is a Procedures Code Manual, CPT, annotation technique developed in 2013 by one of the principals at AMCI to help coders locate, comprehend, and manually abstract codes efficiently and quickly. The CHUN method is ideal for students taking the coding board exams, coders that have daily production standards, and any coder who needs an efficient procedures manual annotation method. All certified professional coding instructors are taught to instruct students to adopt a CPT annotation technique in order that they may have optimal outcomes on the CPC board certification exam. Here are some testimonies from former and current students of AMCI. One former student says, "I truly believe chunning is why I passed. I love it." Another YouTube viewer says, "From the bottom of my heart, your amazing video, your FTR, and your suggestion of CHUN My Manual has helped me pass the exam." TC, who's a current AMCI student, says, "When you CHUN your CPT manual, it saves time, reduced page turns, and it's an easy way to learn your guidelines." And one student, former student, VT, says it best, "If you don't CHUN, you are done." So take a listen to a former student, KB, who passed her CPC exam only after 13 weeks.
But I have to say that they
And I would be remiss if I didn't give you an opportunity to listen to Vembai, who completed the AMCI course in an unprecedented 6 weeks. She's giving her testimony on the importance of CHUN.
And group the families in your book. You need to highlight. You need to underline, and with underlining that makes it easy to identify which things are different in the codes. And then you also need to notate. Notation was really important, because as I was taking the exam, I didn't have to go back into the guidelines and search for different, things that differentiated one thing from another.
All right, we've just learned from our former student that CHUN is the acronym for circle, highlight, underline, and notate. Now let's begin with the steps. Step 1, circle. You circle the families, and that means you circle only the parent code and the indented codes. And number 2, if there are parenthetical notes that correspond only to the preceding codes, you circle them as well. Before we learn how to do the first part of CHUN, the circle and the highlight, we need to define some key terms. The first term is standalone. Okay, the standalone term comes from CPT, and it means that the code stands alone. And it means, well, you'll see what it means as I define the next two. The next term is the parent code. This code, I don't know where that term comes from. However, my instructor told me that it's called the parent term, and I thought it was cool, so I kept it, and that's what it's called. It's called parent, and it's parent because it has a family. All right, it's the head of the household, so it's the parent. And the next term is the indented code, and these are all codes that are indented. They are directly up underneath the parent code, and they're indented, and together they become a family. All right, so let's get started, and let's try and show you how to do the first steps in CHUN. Step 1, circle the parent and the indented code. All right, I'm going to try and use this feature. This is my first time, so bear with me. Let's see if we can change the color. I can't. So bear with me. I'm circling the parent and the indented code to create a family. And if you look at code 10040, I do nothing to it because it's a standalone. It has no family. Step 2, that is your highlight. I'm going to turn on this highlight feature and practice. Okay, I'm just experimenting. This is my first time, so this is exciting. All right, so what do we highlight? Number 1, we highlight the language after the semicolon within the parent code. We highlight that language. All right, and I want to point out, standalone codes do not have semicolons, so only within the parent code. We also will highlight the indented code language, and we will highlight all parenthetical notes. All right, before we move on, I need to apologize. Please forgive the quality of the digital copy. The vendor that I used changed the way that we integrate the content, so it's diminished the quality. And hopefully they're working on that, but in the meantime, let's move on. We're going to learn how to highlight. So I'm going to use my highlighter. I'm excited. I love this feature. So this has changed. All right, so 10040 is a standalone code. And as I've said before, there are no semicolons in a standalone code. And we know that we have to highlight anything that is after the semicolon of the parent code. All right, so we know that 10060 is a parent code because we see the semicolon. And there are parent codes in your text that don't have them. And then you have parent codes within your text that have them, but no language behind it. So be flexible. Don't take everything, just kind of go with the flow. If you don't see it, don't worry. All right, so we highlight what's behind the semicolon and what is at the indented code level. So why do we do that? We do it because the significance of the semicolon is really important, because the language after the semicolon gets interchanged, and the language before the semicolon is shared by the parent and the indented code. For instance, if you want to know the full definition of 10061, it's incision and drainage of abscess. Example, carbuncle, suppurative hidradenitis, cutaneous or subcutaneous abscess cyst, furuncle, or paronychia. Okay, paronychia, complicated or multiple. All right, did you see how I interchanged the complicated or multiple for simple or single? And this is something that CPT uses in order to save space. They need to do that because if they have to write out each definition, then our book would be substantially larger. And I see this commonality in ICD as well. A lot of texts are starting to use these techniques, and I think it's a good one. All right, so we know that we, number 1, highlight anything after the semicolon, highlight at the indented code level, and finally we highlight all parenthetical notes. If it's in a parenthesis, then you highlight it because it's important. All right, so we lost our circle, so let me circle it as best I can. There you go. So this is what a circle and all right, let's take a moment and practice circling and highlighting the families. So we are still on page 71. Let's move down to parent code 10060, and I've got to select the pen color. We're going to select blue because most pens are blue, or if you do it in pencil, that might be even better. I will say that if you make a mistake, you can correct it better. And also, some people say that pencils don't really come up and they smudge, but it's up to you, and it may be up to your vendor where you purchased your book, because that's not the case for all. All right, so let's start with the first parent code. That's 10060. It is not 10040 because, as you can see, it's a standalone code. So let's go ahead and circle the first family. And if you want to move ahead, go right ahead. And the second family, and you see how I grabbed that parenthetical note and include it. And then we even have a third family. There you go. And that's it. Well, wait a minute, we have to highlight. Here's my highlighter, and let's start at the top of the page. The parenthetical notes start here. Again, feel free to move along, move ahead, but it's really important that you highlight everything in a parenthetical note. Highlighting means look at me, read me, and you need to be in a habit of reading everything that you see in a parenthetical note that relates to the code that you are analyzing. Here's some parenthetical notes here, excuse that. Hope you don't do that. And we've got notes here. Yes, these are new. This is new language. And we know it's new because it's in between the inverted triangles. And one other thing you need to pay attention to, you don't see multiple colors of highlight in my book. No, I'm highlighting behind this semicolon and the indented code. And the reason why you don't see multiple colors is because you only should use 2 highlight colors. The first, of course, is your CHUN, the highlight of the CHUN. And the second is your guideline. So to highlight guidelines, you can choose one other color of your choice. Oh, okay, I'm making a boo-boo here, but please try and stay in the lines. It's a little difficult for me because this is the first time I'm using it. And so this is what your book should look like if you circle and highlighted the lower portion of page 71. Step 3, underline. Number 1, we're going to underline words that distinguish families and standalone codes in close proximity. Number 2, we're going to underline anything that needs to be emphasized. Number 3, we're going to use an additional method if more than one distinction is required in a family or standalone code. All right, let me demonstrate. All right, it's time for us to demonstrate underline, and fortunately we were able to retain all of the highlights so I don't have to highlight, but we were not fortunate enough to keep the circles. So let me attempt to circle this. I am going to select a color, and please forgive me because it's not really neat, but we're going to try. Oh, what am I doing here? I'm attempting to circle a standalone code, so that's a no-no. 10040 is a standalone code, and this is the primary reason why you need to do this in pencil. So I was able to erase mine. All right, so my ink color is blue, and I'm going to circle the families. 10060, 10061. That is one family. Let me try and do it as neat as possible. 10080 and 10081. I'm going to circle that along with the parenthetical note. 10120 and 10121. I am circling it as well with the parenthetical note. Now we're going to get to it. Let's go ahead and talk about underlining. All right, I've got to get the correct color pen. So typically, I underline in red or blue, and I think there's another color. But for the purpose of this demonstration, I'm going to use red and I'm going to use blues, and here is why. Because in step 3, the underline step, we have to underline words that distinguish the standalone codes as well as the families that are in close proximity of one another. And we also have to underline words that require special emphasis. So first, let's deal with the standalone codes as well as the families that are in close proximity. All right, so we have 10040. This is acne surgery. There's not going to be a mistake that we'll make because this is the only code that deals with acne surgery. However, family 10060 and family 10080, these two procedures are very similar. One is incision and drainage of abscess. The other is incision and drainage of pilonidal cysts. Now, family 10120, this is incision and removal. So let's deal with the incisions, okay? Incision and removal and incision of drainage. Those are two procedures that could easily be mistaken for one another. You know, when we read really fast, we don't read completely, we could make a mistake. So I'm going to draw a line up underneath the procedures that are in close proximity, like right next to each other, that we could make the mistake. So incision and drainage and incision and removal, these are two that need underlining because you need to pay attention to it. Now, the other thing that we have going on is we've got 10060. This is incision and drainage as well, but this is incision and drainage of an abscess. And the code or the family right up underneath it is incision and drainage of pilonidal cyst. So those could be mistaken if we don't do something to distinguish them. So this is a circumstance where you have one family that has two, basically has some likeness to two different families. So you have to do something different to kind of take your eye in a way, or draw your eye in a way where it won't be confusing. All right, so if I look at these codes now, and I'm looking at the code set from 10040 and 10121, I can see at a glance that there are some distinguishes that need to be made, and I need to be able to see them very quickly. And I can see 10060 is abscess, incision and drainage of abscess. I can see 10080, that's incision and drainage of pilonidal cyst, and 10120 is incision and removal of a foreign body. So I see that very easily because of the line, the underlining that was done. And no, abscess and pilonidal cyst are circled, but those are some options that you have when you've already used the underline, because you don't want too many. So you can circle, that's an option, or you can put a box around it, that's another option. The other thing that I want to point out, whatever you choose to do, whatever method you choose to do, make sure it stays consistent. make sure that if you're using boxes, use boxes only on that particular page. So if you want to use green boxes, make them all green. If you're using underlines that distinguish the family, make them all whatever color you're going to make them. Keep them consistent on the page. However, if you want to turn the page and you want to change the colors of the pens, you may. All right, so keep your boxes or your circles consistent in color and shape. All right, so there's one more thing that we need to underline. And I'm going to get my red pen out. I think I'm going to get I want a lighter pen. Okay, so the other thing that you need to underline is anything that requires emphasis. Now, if you look up here in this area underneath 10022, you have a lot of highlight. All right, so the highlighting is excessive and you may not see everything that you need to see. So I would take that red pen and I would underline the key words that you need to emphasize or need to pay attention to. So this is placement of percutaneous localization devices. All right, so if you have a circumstance where there's placement of percutaneous localization devices, you can see it really quickly and you can look down and know how to code it. Look right up underneath it. Then you have something for radiological supervision and interpretation. If you want to know how to code that, just look at the codes underneath. And then you have percutaneous needle biopsy, other than fine needle aspiration, of course. The codes that you need to reference are beneath it. And finally, for evaluation of fine needle aspirate, I believe. So please don't quote me. If that is the case, then you need to reference these codes to the right. All right, and let's see. And also here you have report 10030 for each individual collection of drained. So I'm going to say each individual collection drained with a separate catheter. That's important. And then this do not report 1000 in conjunction with those codes. Typically, you know what I do, and I know this is not underlining, but this is what I do. Every single do not gets a blue star, or more like an asterisk. Okay, I'll put it on both sides because you know what that tells me to do? Look at it. All right, so let's take a look, and let's look in these inverted triangles. It tells you to use this code in conjunction with the code above it, so you don't need to do anything. Here's another do not. And to report a second procedure, I'm just gonna. Okay, I would like you to test yourself. I want you to look up the codes 29880 and 29881. Then I'd like you to measure how long it takes you to determine the difference between the codes. Yes, what is different between the codes? Start now. Pause the presentation to solve. All right, if you said that the difference between the codes 29880 and 29881 is and or, you're correct. But what I'm interested in most is how long did it take you to figure that out? Well, I think quick readers, the average quick reader should take about 1 minute, and then I'm being generous. With CHUN, it should take you about 2 seconds. Can you imagine that if you CHUN'd your entire CPT manual or just the surgery section, and you can save about 1 to 2 minutes for each page? I think that's going to really convert into some time saved on the exam. So what I would do is I would take the amount of time that it took you to look up the difference, what was different about the codes, and you may be able to convert that into actual potential minutes that you can save. You can multiply it by, well, I can't do the math right now, but I would say the average person that chuns their book can save anywhere between 30 minutes and 1 hour. So if that's not convincing enough to encourage you to use Chun, there's nothing else I can do at this point. But I would hope that you get it, that decreasing the amount of time, focusing on the difference between the codes, will convert into time saved. All right, and if you notice on my page where the codes are, I used a different technique. I used some boxes. And why do I change it up? Well, I change it up because I think your eyes just don't become accustomed, so easily when you change it up. Now, notice I change on that page. I do not change on, I changed from page to page, or every 2 pages or every 3 pages. I do not, make everything is consistent on one page. All right. So if I'm using boxes on this page, there will only be boxes. If I'm using red boxes, there will only be red boxes. If I'm going to the next page and I choose to use blue circles, there are only blue circles on that page. Do not mix up the techniques on the page because it will become very, very confusing. Also, too, no, I'm not going to discuss that. That's all I want. That's the only points I want to make. Oh, yes, I do have a point. And the point that I like to make is, if you notice codes 29880, 29881, they're in the same family. Yes, these are members of the same family. So, yes, not only do codes from different families require distinction, but within the same family. All right, let's move along. All right, so notate at the top of each page the red headings and the blue subheadings. Number 2, notate at the bottom of the page the facts or guidelines to remember. Those are FTRs or GTRs, that's what we call them. And number 3, notate at the code level any keyword or guideline that can assist with correct coding. There you go. All right, we're ready to go, and we're going to learn about notation at the top of the page. But before we get into it and we start talking about notating at the top of the page, we have to understand the significance of the headings and the subheadings. So first, you see green bold on my page 71. I think yours is a different page. Oh no, I think we have the same page. So the green bold emphasizes the section. That tells you the section of the book that you're in. So we're actually in the surgery section. The red bold tells you the heading. This is actually what they call the heading, but I say that it's the location on the body. So for the surgery section, that's 10,000 through 60,000. The red bold typically indicates the location on the body, and the blue bold, which is called the subheading, indicates the procedure. All right, so the green bold is your section, red is your heading, the blue is your subheading. All right, so now that we know the formal terms, I'm going to tell you why you need to only, first of all, we're not going to consider the green bold because we know what section we're in. But the red bold and the blue bold must be documented at the top of each page of the corresponding codes. Okay, so I'm going to show you now. All right, Here is my demonstration of why we need to document the red bold and the blue bold at the top of each page. All right, on this page, where the code series, in the musculoskeletal section, you've got amputation, incision, and excision. So if you look at the page, you know where the hand and the fingers red bold, that's the location, where it begins. It begins at the middle of the page, the left hand column, and directly underneath the hands begins the first procedure. That's incision. The next one is excision. So you have a clear understanding of the location on the body and the procedure. However, directly above, you see the word amputation. All right, we can read the code language and we can see it says forearm through radius and ulna, and we can guess that this is the arm or upper arm. Don't know, have no idea. The only way that you will know is if you turn the page. All right, so if you turn the page, that means that you are wasting some valuable time, because remember, on that board exam, they give you the codes. So if they give you the codes, you will put yourself at an increased advantage if you can just look up the code, and on the page, you can quickly and efficiently get everything you need without having to turn the page. All right, so we're going to turn the page. All right, so we've turned the page. Now let's look at the codes on the left-hand side. Who remembers what section we're in, what location on the body? And also, who remembers which procedure? I don't. I don't know. You all may, because you all may have, a better memory. But on the board exam, sometimes no matter how good your memory is, the stress and the anxiety can cause you to have some lapses. So if we'd already documented at the top of the page that where the procedure is excisions, and we've documented that hands and fingers is what the procedure, or that's the body area, the location on the body where the procedure is being performed. If it was already written on the top of the page, there would be no need to turn the page. Now, some of you might say, oh, well, turn in one page, it, shouldn't matter. That is correct, but often you may have to turn several pages to find out your location. So I just, as a practice, I insist that if you want to have the best possible outcomes and you really want to reduce time on this exam, document at the top of each page that does not have the location on the body and the procedure. Make sure you document it. So this whole page deals with hands and fingers. That's why my hands and fingers is pretty large. And the left-hand column is excision. And the top of the 26215 is excision as well. But then we get down to repairs and revisions in this right-hand column. So I went ahead and put it at the top of the page. However you want to do it is fine. It is definitely up to you. So let's move on to the next page. This is mine. This is what my repair, revision, and reconstruction CHUN page looks like. So you see, it's not really busy. I can do whatever I need to do with this page. There's not a lot of lines going on. Maybe I didn't need it. Another thing about the musculoskeletal section, there are a lot of similar procedures. So because this is the bone, many of the procedures are the same. So if you have an arm and you're dealing with the bones or the muscles in the arm, many of the procedures are the same with the bones and the muscles of the leg. Many of the general procedures, such as excisions, incisions, fractures. So it's really, really important that you document in this section. Document everywhere, but this section can really get you on that exam. You could think that you're coding in the correct location, and you could be in the wrong location. So, gotta make sure you document at that top of the page. All right, here's our second type of notation. This is notation of the keyword at the code level. And we call this at the code level because it's not at the top of the page, it's not at the bottom of the page, but it is located at the code level where the code is documented or next to the code. All right, so since we're talking about the top of the page, I've notated my blue bold and my red bold. We are now in the debridement section, or we're performing the debridement procedure on the skin. So, and it looks a little different than the way I've documented it previously. Whatever works for you. This is a little more quick, and I particularly use this. My skin, is the same size as the debridement because it doesn't matter as long as I know the location on the body and the procedure, I'm fine. All right, so my first notation is at 11042. This is subcutaneous. The second is 11043. That's the muscle or fascia. The third is 11044, bone. Now, how do I know to pull that out, and how do I know this is the key word? Well, I know it's a key word because I really actually know the guideline, and on the next page you'll see why. But it's also in the code language. The code language specifies that 11042 is debridement. Subcutaneous tissue includes epidermis and dermis if performed first 20 square centimeters or less. And this is very significant. I pull it out because it is guideline. The code is coded according to that keyword. All right, so I know that the guideline says that you code the deepest level tissue removed. So subcutaneous is the deepest level tissue removed that you can use code 11042. Muscle or fascia is the deepest level of the tissue removed, 11043, and bone for 11044. So that is what I do. And here's another technique that I use. Whenever you have a code level keyword, if that word or that keyword pertains to everything within the family, I put a double line up underneath it. And that's just my technique. That's just what I do. You can do something else that might work for you. And I put a double line. I'm going to put a double line under muscle or fascia. And I'm going to put a double line under bone. Now, let's say that this keyword only applies to the one code. If the case, I put a circle around it. Okay? So you can do that, or you can put a box. Create your own technique. All right? It's really important for you to add yourself to this technique because all right, here we are. I misspoke and I said previously that we were at the final notation. No, please forgive me. The final notations are the FTRs and GTRs. Those are your facts or guidelines to remember. And these notations are made at the bottom of each page of the corresponding codes. The reason? So that you don't have to look up the guideline. You simply place the guideline at the bottom of the page. So we're on page 73, and these codes are the codes primarily for debridement. So if we have a debridement question on the board exam, if we put our FTR at the bottom of the page, we don't have to look it up. But for the purpose of this demonstration, I pulled the guideline and placed it to the right of page 73. So this is just my doings. So if I want to code or know how to code debridement, I am going to have to, of course, get a different color highlighter so I can highlight my guideline, and I have to reference the guideline before I can code it. No, we are advanced coders now, so we just don't look up a code. If there's a guideline for that code, we need to know it and we need to code it according to the guideline. And FTRs help you out a whole lot. All right, so here's the debridement guideline. Wound debridements 11042 through 11047 are reported by depth of tissue that is removed and by surface area of the wound. These services may be reported for injuries, infections, wounds, and chronic ulcers. So anytime you have injuries, infections, and chronic ulcers, it is okay to use the debridement codes. When performing debridement of a single wound, now they're telling us how to code it right here. Report the depth using the deepest level of tissue removed. So that's why on the previous page, I pulled out the key word according to the guideline, because the key word is the deepest level of tissue removed. So that subcutaneous is the deepest level for the code that corresponds to my documenting of subcutaneous. Now, when there are multiple wounds, you just simply add them up because it says sum the surface. So add up the wounds of the same depth. So don't add wounds from different depths. If you have a debridement of subcutaneous level, of fascia level, and of bone level, those are 3 separate codes. All right, so we've got our guideline here, and also where the coding tip is, there's your guideline. Again, they repeat it again. And I guess that's good for the people that just don't really want to read all of that scenario or all of that instruction. They can just get it really quickly. So at the coding tip level, it says when performing debridement of a single wound, report depth using the deepest level of tissue removed. In multiple wounds, sum the surface area of those wounds that are at the same depth. So essentially, I just put my FTR at the bottom of the page, right there. The FTR means this is how you guide it. This is how you code it. Excuse me. This is how you code it. This is your guideline. It says surface area, code the surface area, code the deepest wound tissue, and add wounds of the same depth. That's all it is. So, okay. Well, we've got some codes here, and it looks like they're going to span the page. So I'm going to show you how you would circle them. All right, so we're going to draw sort of an arc, or a semicircle, or a half circle, whatever you want to call it. And we're going to put some downward arrows just so you know that you're going down, that this is continuous. And then we end, this is the parent code here, and so the indented codes are here. 11601, 11602, 11603, 11604, 11606. And I know when people are starting to chun, they're like, well, we don't know what the difference between the parent code and the indented code. Well, the parent code, pretty much they have a complete definition. And the first part of the definition, the portion before the semicolon, is common code language. So it will say excision, malignant lesion, including margins, trunk, arms, legs. And then the semicolon says excise diameter 0.5 cm or less. So it's pretty much a complete, statement, whereas the indented codes are not. And they typically don't make sense because they're missing something. So they need their parent. All right, so let's go ahead and link it with its parent. There you go. And this tells you that these belong. Their parent is somewhere else, okay? And that's what you do. And now we have more codes. This 11620, these codes belong to codes on another page. Okay, sorry about my free hand. It's not good. And there you go. So if the codes span the column, draw downward arrows from where the codes begin, and then draw, like, let's say if this was the entire page, you would just draw it all the way down if it were the entire page, like that. Okay, so you would just have one long page. So let me erase that. Okay, here we go. Remember, this is coming right from the arc. Then we have to go, these belong to now. The page at the bottom is actually the next page. And we have to link the families. And you noticed I included the parenthetical note up underneath 11646 because it corresponds to those codes in that family. All right, so that's what it looks like, and I hope I haven't confused you. Okay, here are other items outside of CHUN that you should note. In sections where there are multiple families with lots of parenthetical notes, highlight the parenthetical note and don't highlight within the families. Simply circle them, circle the families, and document the keywords, okay? You don't want too much highlight, and there's one section in particular that I find that if you were to highlight the parenthetical notes as well as the indented and the portion behind the semicolon, you're going to have pages of highlight. You won't be able to distinguish anything. So you have to make that decision, but it is important that you don't overload your pages with highlight. Number 2, use a yellow highlighter to chun within your families. I recommend yellow because it's first of all, it's good. It's good to draw your attention. And another thing, you can find yellow highlights everywhere, and you're going to need a lot of highlighter. So make sure you can, if you choose a color that's not yellow, make sure you can get it. Make sure it's accessible to you. Number 3, choose one different color to highlight your guidelines. Number 4, use boxes, red pens, green pens, purple pens when codes require further distinguishing. And remember, be consistent on each page. Make sure that your pages don't have multiple patterns. So if you're using lines and boxes, be consistent with your pattern as well as your color for each page. So you can change up the next page, but just be consistent on the page that you're working. Number 5, in your CHUN notes, annotations with circles around them apply only to the code beside it, and the annotations with the double lines underneath apply to all of the codes within the family. And that's it. So we're going to do a quick review and we are finished. All right, so by now you all know how to CHUN. Let's take a quick review. Circle. We're going to circle the parent code as well as the indented code. I'm going to do that really quickly. We've got 3 here. That's 1, 2, and 3. Note that I left out the parenthetical note because it corresponds to all 3 families. H is for highlight. Okay, I lost my circles, so I'm going to place them back in here. So we're going to highlight the language at the parent level that comes after the semicolon, as well as the indented code language and all parenthetical notes. Next, underline. We are going to underline the words that create the difference or that emphasize the differences between the families, standalone codes, and within families. All right, so we are going to underline, and we're going to also underline things that require emphasis. And in this case, we have axillary, inguinal, perianal, perineal, and umbilical. These are all words that they're the differences between the families, and underneath in the parenthetical note, that skin graft or flap and closure and bilateral, those all require emphasis. Finally, we have our notation. So let's get going with that. You notate number 1, the red and blue bold at the top of the page. Number 2, you notate the FTRs and GTRs at the bottom of the page. Number 3, you notate the keywords or guidelines at the code level. All right? And that's how you do it. Let me go ahead and circle. We can't retain our circles for some reason, but that's okay. There we go. So that is almost a completely annotated in a complete CHUN right there, right in front of you. So if you understand it, that's awesome. If you need to review this lecture or video, feel free. I want you to remember that if you do your absolute best, you have done the best. Happy coding from Absolute Medical Coding Solutions.